All right, forget bungee jumping, skydiving. You really want to add some excitement to your life? Just pop in some eye drops, see what happens. Tell us what's up.
So recently, there's been a recall of some artificial eye drops, artificial tears, not eye drops, artificial tears, because they contained a bacteria that is multi-drug resistant, it's causing blindness, and it's even caused death in some of the people that have used it. The concern that I have is that there is a rise on these multi-resistant bacteria and what that's going to mean to our future in medicine. Because if our strongest antibiotics are no longer working and these bacteria are able to survive despite them, then where is this overall health going to go? Um, you know, what do we need to do to be good stewardship, have good stewardship of our antibiotics and, knowing when to properly ask for an antibiotic versus, oh, you have a virus. Antibiotics will not work against a virus. Stop asking for them.
I agree.
Oh, I think he hit it right on the head there. So, yeah, I don't understand completely how the meds work in the US because I know that it's a completely different system. But you shouldn't be the one making the request for antibiotics or antibacterials because you are the layman. You're coming in to see a doctor, and the doctor is the one who's supposed to be prescribing you what is best for the situation.
That's how it works
So
here.
if someone's coming in off the street saying,
Not
I want
as
to get
much.
this antibacterial, and that's really not cool with me. So the issue is right at the root with the physicians, with the doctors who are over prescribing antibiotics. We know that that's a thing, that they are being over prescribed. And this is
I
why we
mean,
find ourselves in this situation, or this is how we find ourselves in a situation like this. And
yeah,
this one was really weird because when I did a little bit of reading, this was all linked to Esricare products, and they're all linked. That's an India-based global pharma healthcare. So the recall affected a couple of different manufacturers of these artificial tears because this particular bacteria usually doesn't come in through the eyes. So this is what's really kind of making it a little bit different. And for these poor people who have had their vision impacted, who have gone blind or died, oh my God, that's horrific.
I don't,
Absolutely horrific.
I don't know that we've the clearly explained the science to our audience of what's going on with the antibiotics because you know well
yeah.
we
So
understand.
I
So
was going to say, because like Nia, you had said something like, oh, it works the same way here. Not quite. I mean, there's been a huge shift in the last 15 to 20 years about direct marketing to the public about drugs. If you think about you see these commercials and then they give you that quick list of all the quick side effects that you don't really listen to because they say it too fast. But there's a direct marketing to the people who have the least information. I mean, you know what's going on in your body per se, but you have the least information on truly understanding how do antibiotics work? How do antivirals work? How do these things work? All you know is that you saw on TV, there's a drug for something, and hey, I think I have that. Let me go talk to my doctor. Now, it should be a thing to start a conversation, but it's not. I mean, doctors are feeling pressured to prescribe because these patients are seeking this drug, and if you don't do it, then they'll just keep going to somebody and find somebody who will. So,
I
I,
disagree with you a little bit. Um, I don't mind the direct marketing to individuals because we're still controlling. They still should be controlling who gets what drug by prescriptions. So if the doctors are doing the stupid thing and listening to their patient on what they should give them, then the doctors are stupid, and they need a new doctor. But the system is set up where we go into the doctor and they give us a prescription based upon our symptoms. We tell them our symptoms and what they are. But the thing is, sometimes, and I like the internet. I'm one of those people that I know my body well. And you mentioned it. I know how I feel. I know what I've dealt with over the last 40 something ish years. I won't say how many. A lot of years. I know when something's feeling weird or off, or when it's one thing and not the other. I know when I'm getting sick and about to get sick, when I'm not, and I have that sense. And then when I go online and look at some of the symptoms, I can start really narrowing down the symptoms and then be able to talk to my doctor about those symptoms. And I can make suggestions based upon how I feel, right? Because I'm like, look, these are all of my symptoms. And I'm one of those people, I over talk to my doctors. I give them too much information. I think my doctors get tired of me quickly, but I give them more information than than they really need. I just give it all out there. And so I don't know. I don't think that it's a bad thing to let people know that there are medicines that exist. Some doctors don't even know all of the millions of medicines that could potentially help a person, right? So making the doctor aware and having him research the medicine to see if it makes sense, I think that's a good thing.
No, that's not how
It would be if it worked that way, but it doesn't. I can tell you right now, it does not. It does not work that way at all. It should be a starting point. I mean, if it started out great, to say, hey, direct marketing, have this discussion with your doctor. People are crazy.
That works.
And I see a comment online. I said, I see the comment that says, Neil, you missed her point. Doctors have pressure from patients who are not doctors. Mike Winter. I didn't miss her point. I just disagreed with her point. I think that individuals know their bodies better than the doctors do. So there has to be a balance between the two.
You know the symptoms better. Yes, you know the symptoms better, and you are your advocate. But you do not know the remedies better than the trained expert. So
I'm not
for
saying
you to come in and say these are my symptoms, and I think that this would be the course of action. I know that my doctor loves that I'm educated, that I'm in tune with my body, that I'm communicative. Hates the fact that I do some self-diagnosis where it's like, well, I've looked at all these symptoms. I think it might be something like, okay, once after I'm done giving him symptoms, like, let me stop you there.
How many people have died because doctors got it wrong, because people didn't explain their symptoms well enough or give them enough information? I'm sorry. I'm one of those people, I'm not going to die because the doctors are stupid. Doctors are not perfect.
Lack of input.
Or so lack of knowing what information to give them. Like that's why I say I overshare. But if I have a sense of a particular possible diagnosis, then I know to give more pertinent information. Like if I had a headache last week, right? I may not remember I had a headache or that it was even important to this diagnosis. But if I'm researching, I may mention to the doctor, by the way, I had a headache last week. By the way, I've been peeing a lot. By the way, I'll start to notice these symptoms that may be relevant to what I'm feeling.
Yeah, but people get so caught up on that, like symptom or their self-diagnosis, that they're missing that, if the doctor sits there and says, this isn't the medication for you, they don't understand.
They shouldn't prescribe it.
They don't want to even listen. They don't want to listen to the why.
The doctor advertising for
the doctor said no to me. The doctor needs to be able to say no. That's on the doctor to say that. I think self-awareness. Yes. I think self-awareness is very valuable and very important.
So the doctor.
You should be self-aware, but then you need to be self-aware, but then you also need to listen to the medicine.
Expert. But it wouldn't even matter, because if the doctor can choose not to prescribe the medication I'm asking for.
Mm-hmm. And the problem is that people then just go to doctor till they find someone. They tailor their symptoms. They tailor what they say to the doctor.
Let them kill themselves. I don't want the doctor. I'd rather kill myself than the doctor kill me.
But the doctor gets blamed. The doctor gets blamed for it. The doctor has to go through the
doctor
malpractice.
That they eventually fucked up. Yeah,
we are losing. We are losing. We are in a terrible state. We are losing doctors. There are fields that you can't even find a doctor because they can't even do the malpractice.
I'm not going to advocate for lack of self-awareness. Sorry. I get the problem it causes, but I also get the value it brings. So, sorry. All right, let's get to, is this truth? Oh, there's some comments online. Let me get to the comments online. There's a bunch. That's not how it works. Mike Winter. Jacqueline Robinson, mind you, we live in a country where people literally drank bleach and used a horse dewormer based on medical advice of a fool and online conspiracy theories. You make a good point, but those are idiots and they can kill themselves. That's fine. Let the idiots kill themselves. All right. Mike Winter, Moat doctors are sitting there talking to you with an iPad in a hand these days. Your internet research with no medical degree, with their research versus a degree. But I'm not making the diagnosis. I'm only making them aware of my symptoms. All right. Is this truth, lies, or shenanigans?
Lies, shenanigans.
Some truth born out of some doctor shenanigans.
I'm saying there's some shenanigans with the doctors and these eye drops, and I think it's the doctors need to stop prescribing antibiotics when it's not. Like my wife had got sick a few weeks ago, and she wasn't getting better, and that's usually a sense that it's a bacterial infection. So she went into the doctor, but before they prescribed her antibiotics, they tested her for all the viral infections, and she didn't have one, and then they gave her antibiotics. That's the way doctors should work.
Mm-hmm.